students ask me a question about constitutional prescribing and therapeutical prescribing. And usually when I used to teach materia medica, I find it that when I explain the drug personalities in detail, after that few students thinks that, sir, it is very difficult for us to study materia medica. It is interesting, but how can we prescribe constitutional remedy? And we find that therapeutical type of prescription is easier. So today I am going to address and explain about this question, that first of all, don't think like this, that there is a particular type of prescription method and you should follow monotonously a single method. Homeopathy is not like that. It depends that how you receive the case and what that patient tells you during case taking. How much the patient is explanatory, what kind of peculiar, uncommon, characteristic, differentiating, individualizing data you are getting from the patient. And second thing is, it is also important that patient belongs to which personality. This is very important thing. For example, one fine morning you are taking the case and you find that a female patient who is explaining you in a hurried way, and she is having a kind of irritability, indifference towards her family and children and husband, and there is a morning sickness, there is nausea in the morning, and complaints are better by exertion. So that fine morning you are yourself thinking that I can prescribe CPR for such kind of patient. So the message is, it is such a natural and spontaneous process. When you are getting symptoms, particularly from the remedies which you know very well, then it will become easy to prescribe constitutionally. And suppose some other day you are having some other case and you are talking with the patient for 1 hour, but still you are not getting any peculiar differentiating symptom, or that patient's image is not matching to you, with your knowledge of materia medica, what you had gone through up to your final year or MD exams. And this is the thing in homeopathy, because we learn few remedies, 50 remedies, 100 remedies or 200 remedies, but there are lakhs and crores of the people in the world. So it is not possible that every patient comes to you will suitable or fitted in your few particular polycrest like Nux vomica and Lachesis and Lycopodium and Sepia and Calcareca. So I think this is a proper answer for this question, that if we are getting a case like example 1, in that type of cases we will go for constitutional prescription. And if the case is of second type of example, where I am not getting the constitutional symptom, the personality of the patient, then I will think about the particulars, the organ symptoms, stomach symptoms or kidney symptoms or tonsil symptoms, modalities, aggravation, amelioration, something which is peculiar with the part, with the organ of the patient. And then there comes the therapeutical prescription. So both are having their equal places in our homeopathy. And to explain this with example, today I am going to explain you with the example of graphitis, so that you can understand how we can prescribe on the basis of personality. Before that, I want to show you the image with this, which is called as nucleus of the remedy or the core of the remedy. When I examine the patient during case taking, I am observing two things. Number one, the inner nucleus of the patient, which is made up of his mental symptoms, his temperament, his way of behavior, sensitivities, responses, reactions, and the outer circle here that shows the physical generals like obesity of graphitis, chilliness of graphitis, feeling better by hot milk. So I think remedy selection depends upon these two tools. Either I can differentiate the remedy on the basis of the mentals, or I can differentiate it on the basis of physical generals. These are two strong pillars for prescription. So let us begin with the graphitis. When I think about graphitis personality, it is plenty much similar like calcarea car. And while differentiating patients and finding remedy, always I got some group of remedy. And here with graphitis, I think we should think about calcarea carb. Both calcarea carb and graphitis, they are having fat, fair and flabby, and female are the common patients of both the remedies. Both of them are the chili remedies. But the kind of perspiration which is seen in the calcarea carb is not present in the graphitis. In graphitis, the complaints are ameliorated by the hot milk. There is a desire for hot milk. There is a gastralgia, stomach complaints, acidity, indigestion, which is ameliorated by the hot milk. And in case of calcarea carb, there is a desire for boiled egg. So this is just an example through which I can explain you that how at the same time two drugs look similar to me. Suppose that patient is sitting in front of me and it is fat, fair and flabby person or female. So at the beginning there is a calcarea carb and graphitis, both of them in my mind. But later on, as the case taking process progresses, slowly the remedy will differentiate itself spontaneously. So to move on, graphitis personality is again somewhat similar like natrium mure or sepia or ignitia, calcarea carb, natrium carb. And this is a kind of group of female who are desire for sympathy is there. They are very sensitive, they are very emotional. There is a kind of weeping tendency. In relationship, they are quite dependent upon others. So I can find these similar features in these remedies. So why I am telling this? The purpose is you cannot directly think about single remedy. You slowly enter into a group and you think that patient may belong to certain group. And one more thing, when I think about graphites is a carbon, and there is again the certain similarity between calcarea carb, natrium carb and graphites and carbohydrate, because the similar thing is all of them contains carbon. So in these carbon remedies, the patients are commonly they are female and they are fat and fair and flabby. There is a kind of perspiration, but they are chilly patients and little bit slower action. There is a slowness, there is a weakness of memory, there is a mental confusion. So there comes some similarities. And distension of abdomen is also there. But here it is written in Materia Medica of graphites that it may be fat, fair and flabby, but in other Materia Medica it is also given that graphitis is more over towards the dark complexion and dark skin. So slowly we will see that how graphitis is different from all this group. So graphitis lady at the same time where it is sharing some similar characteristics with ignitia, pulsatilla, natrum, sepia, calcarea carb, natrium carb. The main peculiar difference is graphitis is a remedy for the climacteric age. The female who is fat and flabby and particularly complaints are associated with the climacteric age. So no other remedy equalizes it in climacteric or menopausal age complaints. If you see pulsatilla is a remedy for the age of menarche, beginning of the menses. And if you see both the remedies, pulsatilla belongs to the plant kingdom. So it is also a sensitive, emotional, desire for sympathy and tearful weeping tendency is there. And graphitis is also sensitive, weeping tendency, desire for sympathy. But graphitis is a mineral remedy and pulsatilla is a plant remedy. So there will be the difference while doing his job or work. Graphitis will be more particular, more disciplined, more regular towards her work attention. And pulsatilla is not like that. Pulsatilla complexion is much fair than graphitis. When I imagine graphitis lady, which I have prescribed many times in my practice, they are somewhat towards a dark complexion and obesity is there and the complaints of climaxes is there. One or two more things which differentiates graphitis is 90% time, more than 90% time, there will be the habitual constipation in case of graphitis. If you see calcarea carb, in calcarea carb also there is a habitual constipation, but calcarea carb patient feels better with the constipation and graphitis patient will not. But when you are saying that this is similarity between calcarea carb and graphitis, at the same time again one thing will differentiate graphitis about her menses. If she is the personality of graphitis, there will be definitely the history of delayed menses, late menses and scanty menses. And there is a leukorrhea before and after menses, which is very acrid, which is very excoriating, profuse. So here, just with the help of example, I am trying to explain you. When you will tell me the similar remedy, I will try to differentiate it. And there will be a differentiation in the inner circle and in the outer circle. Remember, the inner circle means the temperament, the nature, behavior, sensitivities, the responses of the patient. And outer circle means these physical generals which I gave you the examples of desires or menses or perspiration. Graphitis is a chilly personality, and peculiarly there is a desire for hot milk in graphitis. If I am thinking that the patient needs graphitis, I must have that knowledge of materia medica that I can ask her whether there is any desire for hot milk. I am not saying that all the guiding symptoms in Dubé's materia medica should match with the patient, not like that, but at least 3 or 4 of them should be strongly matched to the patient. And this is here where the knowledge of materia medica will help us to select the remedy. Then we will move towards the temperament of the patient and how it is different from other remedy. Graphitis female, as I told you, it consists of the carbon. So there is a kind of slowness in the personality, there is a obesity, slowness of the thinking, there is a confusion, weakness of the memory, indecisiveness, difficult to take a decision. Along with this, here also it is much similar like Kalkirya. Both of them are very down to earth and simple personality, what you can call it. While talking with the patient, you can easily understand they are simple personalities and there is nothing hidden inside them. They can speak what they are thinking. So that kind of innocence is present in graphitis. They are kind of uncomplicated and they tend to speak what practically they are feeling, and they are much straightforward. They cannot hide the emotions, or in other sense you can say graphitis is not that much smart or intelligent person that she can hide her emotions and she can manipulate. And here it is different from natrum mur or sepia or ignitia and pulsatilla. They are also sensitive remedies, they are also emotional remedies, but here they are quite smarter than graphitis and Kalkirya. So they can manipulate, they can change their emotions for their benefit. So graphitis is more emotional and shy than Kalkirya also. Shyness and softness is similar like pulsatilla, but that shyness and softness is much deeper in graphitis as compared to pulsatilla. One more thing is there, that graphitis females are more motherly nature. You can call it maternal type, which is again similar like pulsatilla. Maternal means they are very much attached with the family, they are attached with their children, very caring for the children and family, and rather they are depending emotionally on the family. So next personality trait I can suggest, that caring, sympathetic and empathetic. They are having sympathy for others, they really wants to help you, and if they heard some bad news or somebody is suffering from some disease, that time they feel very sad about them. So this is a peculiar quality of graphitis, where they can feel the grief or sadness of others, and this is, we call it as a empathy. They are gentle by nature, they are sensitive, and they are more grounded, feminine in nature, and there is a kind of slowness and sluggishness. Next important personality trait in graphitis is their family. Family is her first love. They suffer when difficulty in her close relationship is there. They are very emotional, sentimental, and sensitive. Next personality trait is kind of indecisiveness and confusion is there, and along with this changeability of mood, there is a moodiness. This changeability of mood and indecisiveness, irresolution is also present in pulsatilla. But you know that pulsatilla is a warm remedy, it is a hot remedy. There is a desire for open air, desire for cold air, and in pulsatilla there is a changeability in the symptom, in the physical symptoms also, which is not present in graphitis. In next phase, if graphitis person will not get the proper association or favorable company or suitable partners, then it shows negative traits. Remaining, every remedy will show some positive traits and some negative traits. But more negative traits comes out if they don't have that favorable association or a suitable company or suitable premises in their family or outside the family. So if graphitis gets that unfavorable atmosphere, then it becomes more negative minded, and there is anger and irritability, which Kent has described for 4 marks. There is anger, irritability, changeability, and answers monosyllable. You can easily note that there will be the less intelligence while speaking, and they try to give you the short answers. Monosyllable means just in one word, like yes or no or okay. This is monosyllable answers. Second thing is, which it shares common with the carbonicums, that is lack of confidence, timidity, shyness. This you will find in calcarea carb and graphitis and natrum carb. It is there. Next thing is, they are very much fretful and fearful, and there are many types of fear will be there. So fear is an important part of graphitis. There is a fear of dark, like calcarea carb again, fear of ghost, which is similar in calcarea carb, fear of noise, night, and fear of future, anxiety about future, what will happen. That is very peculiar type of fear in graphitis, which prevents them from taking any important action. They cannot take a daring step for any of their work. Again, there is a fear of losing their loved ones, or fear of disease is also there in the graphitis personality. Graphitis personality shows a deep attachment and dependability on their family persons, suppose with her children or husband. And graphitis symptoms or her grief and anger is seen increased after the death of someone who is close to her. So this is also one more peculiarity of Graphites. So, I will explain about the physical traits and physical generals of Graphites in second part of this video. Now, I want to conclude, to sum up, Graphites is that kind of female. She is quite emotional, she is sentimental, it is sensitive. There is a weeping kind of tendency, weeping with anger, and there is a lack of confidence. So today my purpose is just to explore the essence of Graphites. This is not the complete picture of Graphites, but I am just bringing your attention towards the Graphites personality, how she looks and how she behaves, so that you can prescribe it constitutionally. I hope you understood it and you enjoy the lecture. I will meet you in a second part of video, and there we will finish the personality picture of Graphites. Till then, goodbye.